Welcome to Conversations with Black Doctors, brought to you by Austin Black Physician Association, also known as ABPA. My name is Dr. Jeff Hutchinson, and I'm an adolescent medicine physician in Austin, Texas. I'll serve as the moderator for our panel today. The mission of the Austin Black Physician Association is to improve health disparities within our community and to inspire and nurture the next generation of Black doctors. If you're interested in learning more about or collaborating with ABPA, please visit austinbpa.com to connect with us. That's austinbpa.com. The purpose of these webinars is to bring health information to our community from trusted voices in the Austin area. We want everyone in our community to have the knowledge to care for themselves in the best way possible. Please share this webinar widely and send any questions or comments to info@austinbpa.com. Today's topic is Return to Learn, Choosing Safety at School. This topic is important to the ABPA and the Black community because one, children need the resources that school provide. Two, the illusion that resources can be separate but equal continues to feed the disparities that we see. And third, after the current pandemic, we will need to keep children healthy. Joining us today are two Austin area Black physicians who are expert on this topic. Dr. Chinwe Ifuribe in adolescent medicine and Dr. Liz Holloman, general pediatrician. Thank you both for joining us today.
Thank you.
Thank you for having us.
Could you introduce yourselves to our guests?
Hi, I'm Liz Holloman. I practice with Austin Regional Clinic in the North Austin, Pflugerville area. I've been a general pediatrician for over 20 years now. I chose to go into pediatrics because I love kids and I get the best job of enjoying a life going from infancy to adulthood. I get to see this with families and grandparents, so it's a joy to do the pediatric medicine that I do.
Great.
I'm Dr. Chinwe Ifuribe. I work as a pediatrician with special training in adolescent medicine. I am at Lone Star Circle of Care located in Round Rock. I chose pediatrics similar to Dr. Holloman because I just love kids and the resilient nature that most kids possess. Now, I worked more with adolescents and young adults because I saw that they have the most potential for learning skills that promote healthy behaviors in adulthood. So in addition to caring for patients in clinic, my current projects involve empowering youth to take charge of their health by coordinating health workshops at our clinic and supporting health settings to create youth-friendly policies and practices that promote adolescent-centered care. I really appreciate this opportunity.
Great. I'm so glad that you're both here for this conversation. For as long as kids have been going to school, there have been risk of them coming home from school after catching something. With the reality of COVID right now, Dr. Holloman, what are you telling families who are worried about in-person schooling?
What I first tell parents is there's no right or wrong answer with this. I think that's what parents really want to hear. They, for whatever reason, make one decision or the other, and I tell them these are the pros, these are the cons of either situation, and I let them know that you cannot make a wrong answer in what you're deciding for your child. You always want to kind of keep in contact with your pediatrician and make sure that they're accessible to you so that if there are questions when you decide on that pathway of in-school learning or at-home distant learning, that if questions come up, that you have access to them or their nurse triage system or the school system as well for any questions that do come up based on whatever decision that they've made.
Excellent. Dr. Ifuribe?
Yeah, I totally agree on all those points. One thing I definitely counsel them on is the importance of patience, having patience with others, and adapting to change. I mean, we are all navigating a new normal with this pandemic. And so I try to encourage them to, highlight the work that school districts are doing to follow public health guidelines and engage their teachers, superintendents with any concerns that they have. Because sometimes what parents are thinking, they might feel like they're the only ones having those concerns, but I encourage them to voice those concerns, because it might be other parents and other families worried about the same thing. And if the schools aren't aware of what these families are going through, they may not be able to put the right policies and practices in place for them. So I really try to empower them to use their voice to see the change or see the results that they're looking for when the kids return to school.
Fantastic. And would you both please share a story or an example of a conversation you've had with a family recently about their concern with this potential situation with the virus, either in person or virtual learning?
Sure.
Go ahead.
Oh, sure. I had one this morning. Literally, I saw a patient through telemedicine. He's a 13-year-old male with a history of asthma. He takes control medications to maintain his asthma. And his mom scheduled the appointment because she wanted me to write a letter to school to exempt him from returning back to school. And at the moment, she has opted for virtual learning, and she hopes that she can continue that, but she's worried that at some point the schools might mandate everyone to come back to school, at least in this school year. And so she's just worried because when I first met him 2 years ago, we were still trying to work to control his asthma. He had not been on his control meds at that time. But so she's worried about his health. But not only that, like this is the part that kind of threw me off. His mom said that he came up to her and said, "Mom, I don't want to die going back to school." Mm-hmm. And it kind of just highlights the anxiety and the fear that these families are experiencing with, the potential mass exposure. But at the same time, it's kind of a way to kind of offer some reassurance, to give them information that they may not have had, without my conversation with them. But that's one of the things that kind of, was evident to me, that a lot of our families are going through a hard and tough decision of whether or not their children should go back to school, at least in this time being.
So you left us on edge, though. What did you tell
I know,
the family?
right? So what did I do? So the thing is, for me, it's not just about staying away from school, because, every family, we have to honor their concerns. So I didn't feel like I was in a position to say, oh, yes, he must go back to school and you're not going to get this letter. So what I tried to identify from her was like, well, if you do keep him out from school, what are your plans to keep his learning continuous, like to keep him learning, to be able to keep him connected to friends that he may not have when he's in school. Like he's really adhering to strict social distancing guidelines and masks. He doesn't even get out the car when they go to the grocery store. So I know he's very conscious of that, but what he was, and even physical activity too, if he's home all day, we talked about the importance of school being an outlet for the kids to be able to have some of those well-rounded, educational activities. So with mom's conversation with me, she said that she was considering options for homeschooling, as she'd already looked into certain co-ops that are sprouting up everywhere. And so she was definitely not going to have him just be home and be delayed in his learning. He was already doing these workouts 50 minutes a day in the garage. And this is a motivated teen, by the way. So I feel like he may not necessarily represent all teenagers, but in this particular case, it seemed like mom had already had accommodations to be able to allow him to still develop in a well-rounded way. And so I did write the letter with some caution to say that, as we learn more information about coronavirus, that, given his history of, poorly controlled asthma, that he might benefit from virtual learning at least this school year. But mom was open to revisiting and reassessing that as the next year rolls around.
So thank you. That's a fantastic example of doing what's best for the family and taking their needs into consideration, keeping it family centered. Dr. Holloman, do you have a story?
I do. And, we hear kind of both sides of it. And I think I'll tell an opposing story of what Dr. Afarube discussed, where I had a family come in and it was a 13, 14-year-old adolescent, and mom was ready to send her son back to in the classroom learning. And she kind of discussed that we don't have any risk factors. He's healthy, no underlying medical problems. The mom and dad were relatively healthy as well. There were no grandparents in the household. It wasn't multi-generational. And her son wanted to go back to school. He wanted to see his friends. And so she asked me, was it okay? Or what did I think about that? And again, we, try not to say, this is right or this is wrong, just what works best for your family. And I think in that instance, now the son did have a underlying speech disability, and so he was receiving 504 accommodations, and that would be very hard for him to receive at home. And he needed other accommodations, like needing longer time to take tests or to ask questions, or he wasn't held responsible if he was tardy to the next class, so he just needed a little help with that. And I felt, and the mom felt, like he could get that better in the in-class accommodations. And she said, he's my kid. If we have to go to the grocery store, he grabs his mask, he puts it on in the car, and I tell him, you don't have to put your mask on in the car. Or he'll ask, Mom, where's the hand sanitizer gel? So when we went over all of those things as far as the healthy precautions, she felt like he could do that. It's peer pressure of the other kids wearing masks. That was not a problem she had with him. And she felt overall that would be the better learning experience for him. And that's ultimately what we want for all of our kids, is of course, for them to be healthy and for them to have a great learning experience.
And that's a great quote right there. That's what we want for our kids, to be healthy. Excellent. So let me shift a little bit to speak to that. What can we do to help protect our kids if they are going to go to in-person school? Dr. Holloman, you want to start with that one?
Yes. So some of the things that they can do is, we know the studies are showing to wear masks. They not only protect us, but they protect our neighbors. Hopefully the school systems can put something mandatory in place to have face coverings. Also, diligent hand washing, using hand sanitizer gel when the water isn't available, trying, maybe not being in big spaces, large spaces where other kids are going to be. We don't know what sports is going to look like this coming year, but that does not, when we look at the things, with the exception of the NBA, the National Baseball League and football leagues, we're seeing numbers with those. So unless they have bubbles, which I don't think that's something they can do for high school, that may not be the best thing. So just kind of telling our children that as well, is try not to be in large gatherings. I know at school, sometimes it's not going to be able not to happen, but we don't want to be in those if we can help it.
Excellent. Dr. Afarube, what do you think? What else can we do to help our kids?
Definitely following all those guidelines. Those would be very key. I think doing things to maintain our immunity is always good, so that before we develop any illness, we have some sort of protection. And, there are different acronyms, different recommendations that different organizations have used to encourage promoting health. I used to be a health ministries director at my church, and we use the acronym New Start, where it stands for nutrition, exercise, water, sunlight, temperance, air, rest, and trust in a high power. In the pediatric field, there's also a common one called 5210, everyday rule. And that's 5 or more servings of fruits and vegetables, 2 hours of recreational screen time. Now, with the screen time, I'll talk about that after I finish the whole thing. 1 hour of physical activity, and 0 sugary drinks. So the 2 hours of recreational screen time, there are a lot of debates now, given that, there's virtual learning requirements for academic and non-academic activities, to keep our youth engaged. I think the main focus should be about having ways to have them interact with other people away from screens. That plays an important role in how they develop socially. And we know that social health, mental health really affects our physical health as well too. So if we can promote that, that's also helpful. 2 other things, sleep and healthy coping strategies are very, very key. And then of course, keeping up to date with recommended vaccines. We're still seeing, and expecting to see the usual illnesses that affect young children throughout the year and seasonally. So things like the flu vaccine is still important to keep up to date. And I have parents ask about supplements to fight COVID. I don't think there's been any supplement that has been proven to fight COVID. Let's keep that in mind. But there are some mixed data and little data out in other parts of the country, world, that had looked at vitamin D being related to lowering respiratory tract infections, and especially for those who are deficient in it. And that's where sunlight is very important. Getting like at least 15 minutes of exposure to sunlight really helps build up your own natural vitamin D. Vitamin C also is helpful. Again, no full data confirming benefits or risks, especially in children. But one thing I do recommend to families is to, and I'll put the resource, at the bottom when we offer links to resources, but there's a website that families can use to learn more about any supplement that they're interested in so that they can be well informed. But yeah, sleep. That's one of the strong research evidence that talks about how your body regenerates itself. When you sleep at least 8 to 9 hours, average sleep that we're expecting for young people, it helps your immune system regenerate itself so that whenever you are faced or exposed to any sort of illness, your body has a host of defense to be able to fight it.
That's fantastic. So that's wonderful advice and focusing on the student. But we all know that students aren't in this world by themselves. The whole family is affected by whether students go back to school or not, and if they get ill. So what are some of the challenges families come up with this returning to school in person?
Yeah.
So I'll take it. So some of the challenges are they're multi-generational families now. Their grandparents live with the families or they help, babysit some of the younger siblings. So when the kids go to school, they're just not coming home in a bubble and leaving everything that they picked up at school. They bring it home as well. So their parents that may have underlying medical problems themselves, high blood pressure. We know in the African American community, being overweight is a risk factor. So we have to consider that as well. And families have to kind of weigh those options when they decide or if they decide to send their kids to school.
That's right.
Yeah, definitely along those same lines too. Work demands with these new public health measures that school might be implementing, that students are screened for fevers. I'm sure there are some parents wondering, well, how much time do I have to take off of work if my child has the slightest elevation in temperature? Or for those with limited health insurance or limited access to care, can they afford repeat clinic visits throughout the year for things that, may not necessarily get as much attention if pre-COVID, but now, with heightened awareness of COVID and concerns for COVID, it might require them to, have to be seen more frequently. And so I think, overall, it's helpful for, schools just to have an ongoing process to engage families as they roll out their ready to learn plans so that, again, there are accommodations to address some of these concerns.
Yes. And as the families are concerned, Dr. Altman, what should families do if they suspect their child has COVID-19 symptoms?
First of all, they should not panic. So I tell patients that it's always going to depend on the severity of symptoms. We want to make sure that we don't send our kids to school sick, even if they think, oh, it's just allergies or oh, it's just this, because sometimes we don't know early on what's going on. But always making sure that they have contact with their pediatrician or the triage nurse with their pediatrician, or if they don't have a primary care physician, with the school nurse if they have questions or concerns. So we don't want people to be fearful, but we do want them to reach out to say, to speak to a medical care provider to say, this is what's going on. Can you lead me in the direction of what I should do next? If it's going into the office and getting tested, there are drive-by centers that you can get tested, or if it's something that's mild, that you can just stay at home. So over the summer when we had our large cases of COVID going on, I would tell families, the testing is not 100%. So just because you have a negative test does not mean that you're negative. So why don't we just quarantine you, the person who is at risk, and all the family members for the time frame, depending on if they were symptomatic or exposure, that can range from 10 to 14 days, and say, what is the test going to do? Because the test may not change what our plan is going to be. And then we kind of use the resource or putting the parent in a financial obligation that my plan is not going to change. So in medicine, we, always want to say, will this test change our plan? And sometimes it won't.
Excellent. Dr. Ifuribe, what about the kids that get really sick? What do people need to know?
Yeah. Now, we are still learning about the disease. What we do know is that youth less than 19 years of age make up a small percentage of the total cases of COVID-19, about 1 to 5 nationally. In Texas, is a little higher, it's about 10%. Now, there is this rare condition called MIS-C, stands for multi-systemic inflammatory syndrome in children. And it is classified by different symptoms, but the minimal criteria is that the patient has some of the symptoms of, just general COVID, where it's like loss of a sense of taste or a smell, nasal congestion, runny nose, fever for more than 24 hours. But in addition to some of those things, they need to have laboratory findings of inflammation in more than 2 organ systems. So not just lung issues, but also GI symptoms with vomiting or diarrhea, and heart issues, whether it's like palpitations or chest pain, and then kidney issues if they're having any sort of like changes in how often they pee. And also having positive COVID testing or exposure to someone with COVID 2 weeks prior to the illness. So those 3 things kind of signify that they have gone into a more severe stage of COVID. And among those who develop the illness, we are seeing the symptoms develop 2 to 4 weeks after the infection or exposure with someone who has COVID. As of July 15th this year, the CDC received reports of 342 cases of MIS-C and 6 deaths in about 37 different regions. Most of these cases were male and between the ages of 1 to 14, which is the average age is about 8 years. Now, in line with our emphasis on these webinar series on health disparities, 70% of those cases were Hispanic and Black populations. So it just goes to show that, there are health disparities as it relates to the syndrome, even in children. And if there are any signs that your child might be progressing to something more severe, it's important to reach out to your healthcare provider as soon as possible, and definitely seeking emergency care if they're having trouble breathing, confusion, or any sort of like color changes.
Great. So as we near the end of this conversation, I really appreciate what you both talked about as being able to have specific recommendations for specific families, that there's not one size fits all. But if there is something that you might generalize that you'd want to tell everyone about sending their kids back to school, is there anything that you really want people to know or really want to share?
I think Dr. Afuribe kind of summed it up. It's changing. I mean, we may have our thoughts on it's a good idea or it's not a good idea today, and in September, depending on what happens, that can totally change. I've been practicing medicine for 20 years. That's not a long time, but I've never seen anything like this before. I've never seen anything so in flux, so contagious, and touches the world on every level, socially, economically, emotionally, educationally. So I, again, tell parents to be patient. Recommendations may be A on one day, and they may be B on the second day, and C on the third day.
Definitely. There's this book called Who Moved My Cheese? It really adapting to change. And the way I kind of imagine this as relates to school is that this pandemic is like a crazy bus, and there's ever evolving roadmaps, like for real. So being patient is very key. I like to also add about the empowering of voices across ages. So from parents being able to speak up to the schools, and from young people being able to speak to their parents, their caregivers, and the schools that are planning to care for them. When it comes to young people, because young people, they're worried about different things. They're more worried about like their social interactions, extracurricular activities, and safety maybe on that list, further down. But it reminds me of a high school senior who came to my office for an injured foot playing football. His x-ray showed a fracture. And so I discussed that, the orthopedic specialist is probably going to have him wear a cast for some weeks. and his countenance fell and he was disappointed. And I initially thought he was just sad about the injury, but it turned out he was more disappointed that the cast and crutches would clash with his already prepared outfit for his prom. So I mean, we took time to consider how his outfit can be modified so that he can still dazzle, with his peers. And he left the visit less heartbroken. But I think that positive outlook, research tells us, may have even helped his healing.
Right.
So let's not underestimate the importance of staying positive, the importance of really hearing young people, and acknowledging and honoring their concerns and fears, but also teaching them skills to be able to adapt to changes in life. Because if they can learn it in this kind of situation, as we're learning it as adults, who knows what kind of adults we are, building from this generation.
Absolutely.
You two are fantastic, and I bet most of the people watching this wish that you were their pediatrician and could work with you. But the reality is we're limited. There are only so many people out there who can do the job. Do you have any advice for parents as they're talking to their provider of things that they might say or might ask to help make sure that their provider provides that same kind of care, that they look at them as individuals and not just the next patient coming through their clinic?
I always tell my patients that they need to be advocates for themselves and for their children. That's their primary job as a parent, is to be their child's advocate and feel like they've been heard with any questions that they have. I will be the first to tell a parent, if I don't know the answer, I will find someone who does know the answer. Or if you don't trust me and what my answer is, I'll give you other recommendations, because I know that I'm practicing evidence-based medicine, and we're living in a world that people can look things up on the internet and they know their physician does. So I just always tell a patient is to be their child's advocate and always do what's right. And if something doesn't sound right, or something doesn't feel right, then absolutely go get a second opinion. As a physician, it should never affect us, or we should never take it personally if we know that we're doing the right thing. And that's what we go into this for, especially pediatrics. I mean, my husband used to ask me, why don't you wear heels? Why don't you wear a suit to work? And I'm like, do you know what I do? I get pee-peed on and poo-pooed on and thrown up on, but I would not trade that in for the world if I had to do this all over again. I get to see babies who can only cry and need someone else for their everything, and then I get to see them walk across the stage and go off to college to live by themselves, to start a new journey. So this is an awesome job.
I totally, you and I think like we're twins or something. I say exactly the same thing. I say exactly the same thing. I think any healthcare provider that feels like their word is the last word and the only word as it relates to patient care.
Right.
I tell parents to be careful about that.
Mm-hmm.
Even when families come to me and maybe say, oh, I went to this other provider and they didn't do this. And I always ask them, have you ever talked to them about your concerns? Have you ever spoken to them about that? Because, sometimes if families have bad experiences with providers, they feel they don't have the power to talk, and I don't say talk back, but just be able to address their fears or address their concerns or address things that they expected. Because a lot of times it's about expectations. Mm-hmm. So I always, whenever I have new families, I'll say, what are you expecting from me as your healthcare provider? Because then you and I can be able to negotiate care plans for your child. And if you're a family that requires me to not talk about anything related to medications, we'll broach that as they come up. But I love natural ways of healing. And so it's all, again, being patient-centered, being youth-centered, I think is very, very important for any provider to be able to make sure they're engaged in their family as well.
Great. So my last question for both of you, do you have any resources you suggest for the families to learn more about returning to school, whether it's COVID related or just kids who may not want to go to school for other reasons, just whatever resources might you suggest?
I'll allow you to go first.
You wanted me to go?
Yes,
sure.
Go ahead.
Yeah, so one resource that I really like is Kidshealth.org. It's from Nemours in Wilmington, Delaware. And they really kind of lay out the educational information based on the audience. So they have a tab for parents, they have a tab for teens. That one that was new because they didn't have it when I was in residency. So I was very appreciative that they are talking to the youths themselves. They have a tab for education providers or education or health professionals. So it's really dependent on who you are and what information you're looking for. Kidshealth.org is really, really a good source, I think. And they really touch on a lot of up-to-date, commonly asked questions from different avenues.
Great.
And I also like the resources from the American Academy of Pediatrics and Children's Hospital of Philadelphia, also known as CHOP. And we definitely have to be very attentive of telling our patients this because of anything. You can look on the internet and find whatever you want to believe, whatever you want to be true, you can find it on the internet. And sometimes parents don't know what that is. If you want to see something that's against vaccines, if you want to see something that's against wearing a mask, you can find all that information. And I want my patients to be educated, but we definitely always have to provide them with the best resources for that information.
Yeah. So I had one last resource to offer, especially for teenagers and young adults. It's the Society for Adolescent Health and Medicine website, which is www.adolescenthealth.org. We'll put a link at the end of this page, but it does offer a lot of information for parents and for teens as well, too, as relates to a host of topics, but specifically for COVID as well.
Perfect. Thank you both so much. Dr. Holloman and Dr. Eferibe, you were wonderful. We're so grateful for your time and expertise. Thank you to our audience for listening in, wherever you are. ABPA wants to continue to further its mission to improve health disparities within our community and inspire and nurture the next generation of Black doctors. Please visit our website at austinbpa.com if you or your organization would like to partner with us. Again, that's austinbpa.com. We hope to hear from you in the comments or reach out to us at info@austinbpa.com. Thanks again.